I'd been reading about this rural health project, and since I'd grown up in a rural area, I was really interested in rural health. But they had a maternal and infant care project. It was a federal project. It was one of only 2 of the 60 around the country that were rural, and it served 13 counties around Gainesville. And they'd written some publications about training family planning nurse practitioners and OB nurse practitioners, and sending teams out to the county health departments to take care of moms and babies and family planning. And I really thought that was a neat concept, and we were thinking about how to do that around the Twin Cities. And he called me and said, you know, the fellow who's running that is leaving. I'd really like you to come down and run that. Oh. And, well, I didn't have to be asked twice.
Really?
I went down to do that with, the department is in such a young department that it drove my wife crazy, because he couldn't give me an increase in salary. So I went down for the same salary. Oh. And my wife's going, we're going to move and you're going to have the same salary. I said, but I really want to do this, you know. But going back to Minnesota, one of the things that happened in the late 60s was never supposed to happen again, and that was an explosion of gonorrhea and syphilis. Because we had penicillin and it was never going to be seen again. So they had closed all their VD clinics, as they called them, and then all of a sudden, wham, Minneapolis had a big gay population, and of course, with the pill, everybody was thinking the pill protects you from everything.
Right.
That was a big teaching problem. And so only in Minnesota could you do this. The head of STDs at the state, Hennepin County, and the city of Minneapolis, we all got together, because we were the county hospital, and said, we're going to have to open some new clinics around here, and let's do it differently. Instead of having old, burned out doctors running them, let's run them with nurse practitioners for the women, and, you know, corpsmen that had come back from Vietnam for the men. And let's set them up to be gay friendly, and let's don't call them VD clinics, because a lot of businessmen come in for treatment. Let's name something else. So we called them the Red Door. And they just had a big red door.
Right.
I don't think it fooled anybody, but that's what it was called.
Yeah.
And it was very successful. The first year, and the first one we opened, we saw 19,000 people, and really, it just, my job in overseeing it was every time we had a new case of primary or secondary syphilis, I had to go see it and make sure that that was what that was, because that was more serious than the gonorrhea. Herpes came in at that time, and we didn't really have much we could do about that.
That's right.
Except get people to use condoms and so on. But so it was very successful, and a really good model, and it horrified the medical profession, because, you know, here was one doctor and all these other people working, and actually that's been a problem over the years, even in Gainesville. What was I doing supervising 6 nurse practitioners?
Right.
How could they possibly function without me standing next to them?
Right.
So we went before the nursing board a couple of times about that, and said, well, it's either that or the people don't get cared for. What do you...
So the nursing board was critical of that model?
Yes. Nurses are very tough on
They
other
are.
nurses.
I know, that's true. You're right.
Yeah.
So it was more than just the medical board that was critical of that model. The nursing board as well.
Well, it was the medical doctors in Minneapolis didn't like the model. In Florida, the medical board didn't have anything to do with it. It was the supervision of nurses fell entirely to the Board of Nursing.